Good day everyone, welcome to our rationalization for LP4, and I'm actually in charge of the first three topics, which is F1, 2, and 3. Let's begin with the first part on care of clients in adult or in pain. Number 1, a client with chronic pain reports to the charge nurse that the other nurses have not been responding to requests for pain medication. What is the charge nurse's initial action? The correct answer here is delta. When a client alleges the staff members are ignoring requests for pain medication, the charge nurse must investigate the situation by direct assessment. The initial step is to hold a staff conference to gather objective and subjective data regarding the staff's performance, clinical reasoning, and attitude towards this specific client. This identifies whether there is a systemic issue, a communication breakdown, or a negative bias or countertransference. 1 is delta. 2. The home health nurse is interviewing an older client with a history of mild heart failure and rheumatoid arthritis. The client reports feeling pretty good, except for the pain and stiffness in my joints when I first get out of bed. Which member of the healthcare team would be most appropriate to aid in the client's report of pain? Answer: delta. Because we know that morning joint stiffness and pain are classic pathophysiological hallmarks of rheumatoid arthritis, caused by accumulation of inflammatory waste products within the synovium during prolonged periods of rest. Non-pharmacological heat therapy causes vasodilation, which improves local circulation and joint mobility. Delegating the task of assisting the client with a warm shower in the morning to a UAP is an efficient use of the healthcare team to address this predictable daily symptom. 2 delta. 3. A client with diabetic neuropathy reports a burning electrical type pain in the lower extremities that is worse at night and not responding to nonsteroidal anti-inflammatory drugs. Which medication will the nurse advocate for first? Answer is A, which is gabapentin. So we know that diabetic neuropathy can cause chronic neurogenic or neuropathic pain characterized by burning, tingling, shooting, or electrical sensations due to nerve fiber damage. The type of pain does not respond well to standard nociceptive analgesics like NSAIDs. Therefore, gabapentin, which is an anti-epileptic medication that acts as an adjuvant analgesic by binding to voltage-gated calcium channels in the nervous system, stabilizing hyperexcited neuronal membranes and reducing neuropathic pain signals. 3 is alpha. 4. The nurse is caring for a post-operative client who reports pain based on recent evidence-based guidelines. Which approach would be best? Answer: alpha. Because of course we know that contemporary evidence-based pain guidelines emphasizes multinodal analgesic approach for post-operative pain. This strategy combines different classes of analgesics and delivery methods that target distinct points along the pain pathway, and this maximizes pain control while minimizing opioid requirements and their associated side effects such as respiratory depression and ill use. 4 alpha. 5. The nurse is considering seeking clarification for several prescriptions of pain medications. Which client circumstance is the priority concern? Answer: alpha. Because an opioid naive individual has not developed pharmacological tolerance to the respiratory depressant effects of opioid receptor agonist. Administering a continuous fixed basal dose of an opioid by an IV-PCA to an opioid naive patient is a higher practice. If the patient falls asleep, the basal infusion continues to deliver a steady stream of medication, which can lead to progressive hypocapnia, severe respiratory depression, and respiratory arrest. 5 alpha. 6. A client is crying and grimacing but denies pain and refuses pain medication because my mother is a drug addict and has ruined our lives. What is the priority intervention for this client? Answer: alpha. Pain is a complex subjective experience influenced by psychological factors and personal history. This patient's refusal of pain medication stems from a deep emotional response to a family member's addiction. The primary nurse intervention is to encourage the client to express these fears and past experiences. Validating their feelings builds a therapeutic relationship, allowing the nurse to later provide accurate, targeted education regarding the differences between physical dependence, tolerance, and addiction to the context of acute pain management. 6. Alpha. 7. The healthcare provider has ordered a placebo for a client with chronic pain. The newly hired nurse feels very uncomfortable administering the medication. What's the first action that the nurse should take? Answer: Delta. Administering a placebo, an inactive substance presented as a therapeutic agent to manage the patient's pain outside of a blind formal clinical trial, is widely considered unethical by professional licensing bodies. It undermines the nurse's client relationship and violates the principle of veracity. A newly hired nurse faced with this situation should immediately contact the charge nurse for advice and guidance to navigate institutional policies and establish a safe plan for ethical refusal or classification. 7. Delta. 8. On the first day after surgery, a client receiving analgesic via patient control anesthesia pump reports that the pain control is inadequate. What is the first action that the nurse should take? 8. Answer: Delta. Of course, in accordance with the nursing process, any report of inadequate pain control must be met with an immediate thorough reassessment of the pain's location, quality, and intensity. In a post-operative client, a sudden escalation or change in pain may not be simple surgical discomfort. It could be an early warning sign of a surgical complication such as internal hemorrhage, compartment syndrome, or structural dehiscence. 8. Delta. 9. A client's family member comes to the nurse's station and says he needs more pain medicine. He is still having a lot of pain. What is the nurse's best response? Answer: Charlie. Because pain is highly subjective experience that requires direct validation, when family member reports that the patient is hurting, the nurse's best immediate action is to assure the family that they will assess the patient right away. This response validates the family's advocate role, alleviates their anxiety, and brings the nurse directly to the bedside to perform a formal clinical assessment. 9. Charlie. 10. Pain disorder and depression have been diagnosed for a client. He reports chronic low back pain and states none of these doctors has done anything to help, which client's statement is cause for greatest concern. 10. Answer: Bravo. Chronic pain disorders are frequently comorbid with severe clinical depression, creating a high-risk profile for suicidal ideation. The statement, "I think I'm going to find a way to end it," is a clear expression of a suicidal intent. This requires an immediate safety intervention, including a 1:1 observation and a formal suicide risk assessment and a psychiatric consultation. 10. Bravo. 11. The nurse is caring for a young man with a history of substance abuse who had exploratory abdominal surgery 4 days ago for a knife wound. There is a prescription of to discontinue morphine via patient control anesthesia and to start oral pain medication. The client begs, "Please don't stop the morphine. My pain is really a lot worse today than it was yesterday." What's the best response of the nurse? Answer: Charlie. In an acute post-operative environment, a patient who reports a sudden significant increase in pain compared to the previous day must be evaluated for acute complications such as localized wound infection, internal bleeding, or an abscess. The nurse must first have the patient locate and describe the pain to differentiate expected surgical healing discomfort from a new secondary complication. 11. Charlie. 12. The nurse recognizes that there are ethical considerations in helping clients to achieve relief from pain. Which nursing action is the best example of the principle of non-maleficence? 12. Answer: Alpha. The ethical principle of non-maleficence dictates that the healthcare providers must do no harm. If a client is excessively sedated from an opioid infusion but continues to ask for more medication, administering additional morphine could cause respiratory failure. By withholding the dose, conducting a further assessment, and seeking non-sedating alternatives, the nurse actively protects the patient from immediate physical harm. 12. Alpha. Let's proceed now to F2, care of clients with fluid and electrolyte alterations. 13. The nurse working in a medical unit would most closely assess relative to the risk of dehydration the client who is, answer, delta. Of course, older adults have an age-related decrease in total body water percentage, a naturally diminished thirst reflex, and a reduced ability of the kidneys to concentrate urine. When these physiological changes are combined with dementia, the client may lose the significant capacity to recognize dehydration symptoms or are asked for fluids, placing them at highest risk for severe dehydration. 14. The nurse makes the evaluation that the intake of one of the adults in her care is adequate when she measures the total daily intake as, answer is letter D. For a standard adult with normal renal and cardiac function, an average of daily fluid intake of 1,500 to 2,000 ml is required to balance normal insensitive losses such as the skins and the lung, and ensure adequate renal perfusion to excrete metabolic waste. 14 is letter D. 15. The nurse anticipates that an order for an isotonic intravenous ice solution will read, answer, bravo, that's 0.9 sodium chloride. Of course, an isotonic solution has an osmolality that closely matches human plasma, meaning it expands the extracellular fluid volume without causing a net fluid shift across the cellular membrane. 0.9 NaCl is a standard isotonic crystalloid fluid. 15. Bravo. 16. The nurse assesses a client's urine output and recognizes as indicative of a complication the finding of, answer, alpha, 30 ml or the past 2 hours. Adequate adult renal perfusion is clinically defined as a urine output of at least 0.5 ml per kilogram per hour, which translates to a minimum standard of 30 ml per hour. An output of 30 ml or less over a 2-hour period is an alarming finding that indicates oliguria. This can signal severe dehydration, acute kidney injury, or hypovolemic shock requiring immediate medical evaluation. 16 is alpha. 17. When assessing the laboratory values for assigned client with fluid excess, the nurse finds the value that is consistent with this diagnosis to be, answer, delta. We know that fluid volume excess or hypervolemia leads to a state of hemodilution, where an excess of intravascular water dilutes the concentration of solutes within the bloodstream. A plasma sodium level of 129 is low, which is hyponatremia, which is highly consistent with hypervolemia caused by fluid retention during a diluting serum sodium concentration. 17, the answer here is delta. 18. A client with a severe burn has a third spacing. The nurse explains to the client that often this is self-limiting and will begin to immobilize back into the intravascular space within, answer, delta, 48 hours. Third spacing occurs when fluid shifts from the intravascular space into the interstitial spaces or body cavities, often seen after major burns or trauma due to increased capillary permeability. And of course, because there is this increased capillary permeability, it is important for us to make sure that we don't want the patient to experience that kind of event. So what is our important thing to do is once the acute inflammatory phase stabilizes and capillary integrity begins to return, typically within 48 to 72 hours post-injury. This trapped interstitial fluid begins to re-enter the intravascular space. So 18, the correct answer is letter D. 19. The nurse should assess the client on an IV diuretic for indication of which troublesome side effects of the medication. 19, answer bravo. Of course, loop diuretics such as furosemide and thiazide diuretics promote the excretion of water and sodium from the kidneys, but they also cause significant wasting of potassium in the distal tubule. And decrease in serum potassium hypokalemia is a dangerous side effect that can cause lethal cardiac dysrhythmias, muscle weakness, and at the same time, ileus. 19 is bravo. 20. A client who has a multi-system organ failure has the following electrolyte levels: sodium 129, magnesium of 2.6, and potassium of 5.9. The nurse interprets that this client has 20. Charlie, there is actually presence of hyponatremia, hypermagnesemia, and hyperkalemia, because we know that the normal sodium is 135 to 145, normal magnesium is 1.5 to 2.5, normal potassium is 3.5 to 5.0. 20 is Charlie. 21. A client is scheduled for surgery. The following day has preoperative electrolyte levels drawn. The nurse would notify the surgeon's office to report. Answer, Charlie. The normal reference range for serum potassium is 3.5 to 5, while 3.5 is technically at the lowest edge of normal. Any borderline low potassium level must be reported to the surgical team preoperatively. Anesthesia, surgical stress, and perioperative fluid administration can accelerate potassium loss. Hypokalemia during surgery can predispose a patient to dangerous cardiac arrhythmias under general anesthesia. 21, answer is C. 22. A nurse notes that the client has a stat order for sodium polyestyrene sulfonate or kayaksilate. The nurse quickly checks serum laboratory results, anticipating hyponatremia, hypokalemia, hypernatremia, or hyperkalemia. 22, answer D. Because sodium polyestyrene or sulfonate kayaksilate is a cation exchange resin given orally or rectally to treat hyperkalemia. As it passes through the intestine, it releases sodium ions and binds to potassium ions, which are then excreted from the body in a stool, helping to lower serum potassium levels. 22 is letter D. 22. The nurse reviews a client's serum electrolyte notes. A phosphorus of 1.0 milliequivalent per liter. The nurse will assess the client for a history of 23, answer alpha. Long-term use of antacids. Of course, the normal serum phosphorus level is 2.5 to 4.5. At the level of 1 indicates severe hypophosphatemia. Common cause of this is the long-term use of aluminum or magnesium-based antacid. This medication binds to phosphorus in the gastrointestinal tract, preventing its absorption and leading to depletion over time. 22, the answer is letter B. 24. The nurse preparing an IV calcium chloride for a client with hypocalcemia should administer the drug in 55% normal saline, 55% dextrose or Ringer solution. 24, alpha, I Charlie D. 5% dextrose in what? The correct answer for 24 is Charlie. 5% dextrose in water using 23 gauge cannula. So these intravenous calcium preparations are highly irritating to the veins and can cause severe chemical phlebitis, local tissue inflammation, or necrosis if extravasation occurs. Calcium should be administered to a saline-free solution such as 5% dextrose in water because excess sodium ions increase renal calcium clearance, reducing the effectiveness of the therapy. It should be given through a small gauge cannula like gauge 23 into a large vein to ensure rapid dilution of the medication. 24. Charlie. 25. An older adult woman comes to the emergency department with serum calcium 3.9. From the client's history, the nurse recognizes the probable etiology of this finding is answer Charlie. A serum calcium level of 3.9, which translates into approximately 7.8 mg per deciliter, indicates hypocalcemia, a significant risk factor for hypocalcemia in an older adult is long-term confinement in a nursing home. This environment often limits exposure to natural sunlight, which is necessary for the endogenous synthesis of active vitamin D. Without vitamin D, absorption of calcium or dietary calcium drops significantly. 25. Answer Charlie. Let's proceed now to F3, care of adult clients undergoing surgical or surgery. 26. A client with type 2 diabetes is scheduled for major abdominal surgery, which preoperative nursing action is most critical in preventing postoperative complications. 26. The answer is Charlie. For clients with diabetes undergoing major surgery, the stress response triggers the release of cortisol and epinephrine, which elevates blood glucose levels. Monitoring blood glucose and maintaining normoglycemia is significant because perioperative hyperglycemia impairs leukocyte function, delays wound healing, and significantly increases the risk of post-operative surgical site infection. 26. Charlie. 27. During pre-operative teaching, a client scheduled for colectomy expresses fear of anesthesia awareness. What is the best nursing response? 27 is Bravo. Anesthesia awareness, or waking up or remaining conscious under general anesthesia, is a real psychological fear for many surgical patients. The nurse's role as a patient advocate is to validate this concern and notify the anesthesiologist. The anesthesia provider can then meet with the patient to explain how brain activity monitors and modern gas infiltration are used to prevent this from occurring. 27. Bravo. 28. A nurse notices a client scheduled for emergency surgery has not signed a consent form. What is the nurse's best action? 28. Alpha. Obtaining informed consent is a legal responsibility of the operating surgeon. The nurse's role is to verify that the consent from the patient or form is present and signed before surgery begins. If the nurse notices that an emergency surgery patient has not signed a consent form, they must notify the surgeon immediately so the provider can discuss the risks and benefits and obtain the necessary signature. 28 is Delta or Alpha. 28 Alpha. 29. Post-operatively, the client has shallow respirations and drowsiness. The nurse notes that the patient received morphine IV in the pack. What's the nurse's priority? Answer is Delta. Administer naloxone per standing order. Of course, post-operative sedation and shallow, slow respirations in a patient who recently received IV morphine in the post-anesthesia care unit. Point toward opioid-induced respiratory depression. If standing protocols allow the nurse's priority intervention is to administer naloxone, an opioid antagonist, to reverse the respiratory depression and restore adequate ventilation. 29. Charlie. 30. A client undergoing a laparoscopic cholecystectomy reports shoulder pain in the back. What is the most appropriate explanation to provide? Answer: Charlie. During a laparoscopic cholecystectomy, carbon monoxide gas is insufflated into the abdominal cavity to create space for the surgical instruments pneumoperitoneum. Any residual carbon dioxide gas left in the abdomen can irritate the phrenic nerve, causing referred pain to the shoulder, assuring the patient that this is an expected finding helps alleviate anxiety. 30 is Charlie. 31. A nurse notes a post-operative patient has had no urine output for the past 3 hours, which action demonstrates critical thinking. Answer: Alpha. Critical thinking requires gathering data to identify the cause of a clinical finding before choosing an intervention. An absence of urine output for 3 hours post-surgery can be caused by obstructive tissue such as kink, catheter, or urinary retention, or a systemic issue like hypovolemia. Palpating or scanning the bladder for distension helps determine whether fluid is being retained in the bladder or if the kidneys are not producing urine, which guides the next step. 31 Alpha. 32. During pre-op teaching, a client voices concerns about post-surgical pain management, which response reflects effective therapeutic management. 32 answer is Charlie. The therapeutic communication involves open-ended questions that invite patients to share their specific fears or concerns, responding with "Tell me more about your concerns," so we can create a pain plan, acknowledges that the patient's anxiety and actively involves them in post-operative care planning, which helps improve overall pain management outcomes. That's 32. Let's proceed now to 33. A client is found to have a low serum potassium preoperatively. What is the best nursing action? 33 answer is Delta. Of course, a preoperative serum potassium of 3 indicates hypokalemia. Potassium levels below 3.5 increases the risk of inappropriate cardiac dysrhythmias, prolonged muscle weakness from neuromuscular blockers and ileus. The nurse must notify the healthcare provider immediately to give or to correct this sheet, and of course before anesthesia is administered. 33 letter D. 34. Which post-operative finding requires the nurse to intervene immediately? The correct answer here is A. If there is presence of bright red sanguineous drainage that saturates a surgical dressing on the first day after surgery, indicates active artificial or arterial or rapid capillary hemorrhage. This is an acute complication that can lead to hypovolemic shock, requiring immediate pressure application with vital sign assessment and notification of the surgical team. 34 answer A and D. 35. What nursing intervention best prevents venous thrombosis post-surgery? Answer B. Because we know that venous thrombosis or venous stasis from prolonged bed rest is a major risk factor for venous thromboembolism following surgery. After or assisting the client with early frequent ambulation helps simulate the calf muscle pump, which increases venous return to the heart and prevents blood pooling and clot of informations in the deep veins of the legs. That's number 35. 36. A client is NPO and scheduled for surgery in 2 hours. They request to chew gum for a dry mouth. What's the nurse's best response? 36 answer Delta. Chewing a gum simulates cephalic phase of digestion, which triggers the autonomic nervous system to increase gastric fluid secretions and lower And of course, that is actually important for us to make sure that it will actually not be the reason for possible issues that pertains to ambulation problems. And at the same time, it's important for us to make sure that the patient should be on a specific position. 35 is B. 36. Acknowledge NPO on schedule for surgery in 2 hours. Request chew gum for them. What's the nurse's response? 36 answer delta. Chewing a gum stimulates the cephalic phase of digestion. It triggers the autonomic nervous system to increase gastric fluid secretions and lower gastric acid. If a patient chews gum within 2 hours preoperative window, the increased volume of highly acidic fluid in the stomach elevates the risk of severe aspiration pneumonitis if vomiting occurs during induction of anesthesia. 37. The nurse observes a surgical wound that is warm red and draining yellow fluid on T3 post-op, which is the priority intervention. Answer, bravo. Surgical wound that is warm, erythematous, and draining purulent yellow fluid or post-operative day 3 shows classic signs of a localized surgical stenosis beyond inflating a maintaining a important thing for you to make sure that the patient is actually on an environment that is conducive for healing. So in that case, the answer for number 37 is B. Before initiating antibiotic therapy or interventions that could alter the wound in microenvironment, the nurse must obtain a wound culture to identify the causative pathogen, and this allows the medical team to select the appropriate targeted antibiotic therapy. So I think that is it for our rationalization. Thank you so much for your time.